Hello, my name's Rob Webster. I'm the lead Chief Executive for the West Yorkshire and Harrogate Health and Care Partnership. I'm going to talk to you a bit about some of the things we've been doing in the last couple of months and some of the improvements that we're making. As a partnership of councils, the NHS, communities, the third sector and others, we really want to work together to make the biggest difference that we can. Part of that is taking more control over our own affairs. Recently, we've become an integrated care system, or ICS. This latest acronym really just denotes that we've been given a bit more freedom and a bit more authority to get on with making the difference to the things that really matter to you. As part of this designation as an ICS, we've been given some more resources too. I see this as a down payment on the kind of transformation funds that we want to use in West Yorkshire and Harrogate in the future if we're going to deliver our plan on our next steps to better health and care for everybody. We were given £8.5 million by central government to spend on the things that we think are going to make a big difference. That's great news for us, and we're spending it on some things that are really, really important. We all know that the public needs to have a service when and where it's needed. That means in an emergency, you want to have fast access to the best possible care that's going to meet your needs. So £4 million of the money we've been given is being given to local places to make sure that they always have a response available to people where and when it's needed. We know already that more people, for example, have been seen in A&E departments, assessed, treated, discharged or admitted within 4 hours than ever before. The support for those A&E departments needs to come from the rest of the system, whether that's your GP, social care or others. By looking at the whole system together, we can make sure we have an urgent care system that works. The second part of the money, about £2.5 million, is being spent on looking at how we coordinate and develop those services around general practice, pharmacy, physiotherapy, voluntary sector support for carers and others. And the third chunk of that £8.5 million, about £1 million, we're spending on loneliness and isolation and how we work with charities and others to make sure that people feel more connected to their communities. Also at the heart of our plans is investment in our staff. We know that we want West Yorkshire and Harrogate to be a healthy place to live and a great place to work. And we know that the health and care system is really all about people. I'm delighted then that another £1 million from our workforce budgets is being invested in our workforce, again on things that will start to make the biggest difference. Providing support for our staff who are also carers, making sure that mental health training is available to people, and making sure that we invest in a passport for staff so that they can work in different places without having to redo training or assessments or other things which may get in the way of them doing their job. So as a partnership, we can point to some significant changes that we're making. And over the last couple of months, we've been given an additional fillip with this extra £8.5 million and this extra £1 million into workforce, which is really a reward for the work that we're doing together. The true test of the partnership though will be when you see the difference that it's making in your general practice, in your local hospital, with your local charities, in your family and with your friends. And we will see that over the coming years.